of Pelvic Pain Awareness Month, I just wanted to talk a little bit about what pelvic pain is. So pelvic pain is essentially pain in your abdomen and pelvis that's usually below your belly button and has been going on for at least 3 months. Okay, so there's a lot of different things that can cause pelvic pain. It's not just one thing. So everybody always thinks about endometriosis and fibroids and ovarian cysts, and those are all causes potentially of pelvic pain. But the one that's oftentimes overlooked is actually your pelvic floor muscles. Just because you have one thing doesn't mean that you can't have something else. For example, if you have a history of endometriosis or fibroids, it can put a lot of pressure on your pelvic floor muscles and they can become really tight. And sometimes even after we do surgery, your pain still stays there. So why is that? Because your vagina is essentially a tube of muscle. And when those muscles get tight or sensitized, then you can keep having pain. And so those muscles are responsible for a lot of things. They are responsible for urination. They're responsible for having bowel movements. So some people will say they have chronic constipation. They'll say that they have pain with urination, or they feel like they have to go to the bathroom a lot and they can't get their urine out. Those could be signs that your pelvic floor muscles are really tight. So how do we treat that? So the best way is actually with pelvic floor physical therapy. Now, I know that sounds weird, but you have to think of, your pelvic floor muscles as any other muscle in your body. So if you were going to have, if you have a lot of neck pain, you might see the physical therapist for your neck or for your back. And just like, for your pelvic floor, you might need to see a special pelvic floor physical therapist. Now, what will they do? They will typically do manipulations of your lower back, your hips, because it's all very interrelated. But then they will usually do some manipulations inside the vagina to help relax those pelvic floor muscles. And it can help a lot. So if you have chronic pelvic pain and you have, a lot of pain with kind of even like other activities that you don't think of as associated with your uterus, so things like kind of lifting things, sitting for a long time, walking for a long time, if you have pain with intercourse, those could all be signs that something is going on with your pelvic floor. So please seek care for that. We have a lot of great pelvic floor physical therapists who would be happy to see you.